Hey, Dr. Jeff here, and I'm on week 13 of 52 weeks in 2025, where I'm sharing each week something that I've learned in my over 30 years of healthcare experience. Today, I want to address the big C word. And no, I'm not talking about catheters. I am talking about the word change. And over my experience in healthcare, over the years of experience, I have seen that people are resistant to change. But in this experience that I have also seen that change is required, and it does make things better. Now, you may ask, Dr. Jeff, do you always agree with the change? No, I don't always agree with the change. But that's because sometimes I am limited in my sight of how much that change can help the system that I work in. So I know that change is required. You know, a few years ago, I was at a local hospital, and they have a small museum of things that used to be used in healthcare. And as I was looking at those things, I was in awe of how much we have grown in the healthcare industry here in the United States. And so as I'm looking at the changes that have occurred, I also realize that these changes have occurred sometimes because things have happened to patients, or we put our minds together and we come up with solutions of how we can better the healthcare system. Just think about where we are in advancement of equipment. Or now we use electronic documentation, which some of my peers may say is not a good change. However, it creates so many opportunities to be able to track information, look at information, and take data and actually improve based on that data. I came up in the old-time way of handwritten documentation. I have never charted clinically in regards to a nurse's note, etc., or an assessment on electronic documentation. So that's dating me back just a little bit. However, I know that electronic documentation brings some benefits. I also know that the way that we dispense medications brings some benefits based on changes that have occurred with electronic medication dispense. So there are so many things that I see that have evolved in our healthcare industry that actually make things better. So I want to encourage you to embrace change. I didn't say you have to always agree with it, but you have to support change and sometimes grow out of your own comfort zone to realize that change is required in healthcare. So today I'm embracing change, and I ask you to embrace change as well, because change gets us to another level to where we can help our patients and help each other. As we serve together, Dr. Jeff.